Informatics and the future of healthcare invites us to look beyond today's operational concerns toward the landscape we will soon inhabit. In our previous discussion, we explored how sound governance can keep information initiatives aligned with shifting regulations and organizational priorities. Building on that foundation, we now examine the forces that will shape what those initiatives actually deliver. First, consider society's broader currents, longer lifespans, consumer demand for personalized care, and the expectation that digital tools will make every interaction seamless. These trends signal that information will no longer merely support clinical work. It will define the very experience of receiving care. Second, futurists remind us to analyze multiple possible paths rather than predict a single outcome. This mindset helps managers remain agile when disruptive technologies appear sooner or later than anticipated. Third, let us bring emerging directions into clearer focus. Person-centered health will fuse information systems into everyday routines, from nutrition tracking to continuous vital sign monitoring. Technical advances such as the Internet of Things multiplied the number of data sources, while the growing threat of cyber attacks demands robust protection strategies. On the clinical side, richer analytics and intuitive data visualizations promise to convert raw numbers into insight and action, provided we design interfaces that respect the working patterns of clinicians. Picture a rural hospital administrator who equips home care nurses with connected wound care sensors. The manager must orchestrate device procurement, network capacity, staff training, and privacy safeguards, demonstrating how forward-looking informatics strategy translates directly into better healing for patients and stronger performance for the organization. So the objective for this module is to describe the trends in electronic medical records and personal health informatics, and analyze the trends in the broader healthcare technology ecosystem. Think of it as a roadmap, our set of promised milestones. On the previous slide, we sketched the horizon of informatics and its influence on tomorrow's care. Now, we clarify what you should be able to do after today's session. First, you will be able to describe trends shaping electronic health records and the emerging field of personal health informatics. These records are no longer static repositories. They are evolving into living platforms that receive data streams from fitness trackers, remote monitoring devices, and voice assistants. Grasping this shift is critical because a manager who understands how data now flows continuously can design services that feel effortless to patients while still meeting clinical requirements. Second, you will articulate trends that extend beyond the charts and graphs inside a hospital system to the wider healthcare technology ecosystem. Cloud infrastructure, application programming interfaces, advanced analytics tools, and secure data exchanges are converging. Leaders who can weave these strands into a coherent strategy will give their organizations a competitive edge. Consider an outpatient clinic director who notices rising demand for wearable integrated diabetes coaching. By recognizing the trajectory of personal informatics, the director can negotiate vendor partnerships, ensure the electronic record accepts real-time glucose data, and budget for cybersecurity defenses. The result is a service that improves glycemic control and reduces emergency visits, demonstrating both clinical impact and financial stewardship. Keep these goals in mind as we progress. They will anchor our discussions and, more importantly, inform your future leadership decisions in healthcare management. Let us turn our attention to our next destination, futurology, the science of looking ahead. A moment ago, in our objectives slide, we committed to recognizing the forces reshaping electronic health records and the wider digital ecosystem. Now, we sharpen our lens by asking a deeper question. How do we examine tomorrow before it arrives? And how do we guide our organizations toward the version of tomorrow we prefer? Futurology supplies a disciplined toolkit. Rather than idle guessing, futures research gathers evidence, models trends, and organizes possibilities into three categories: what could happen, what is likely to happen, and what we would most like to happen. For healthcare managers, that distinction is crucial. If we only chase probable outcomes, we become reactive. If we only dream of preferable outcomes, we risk magical thinking. True leadership balances both, predicting challenges, planning responses, and managing uncertainty in real time. Picture a regional health network deciding whether to invest in continuous glucose monitors that stream data into electronic health records. By applying futurology, the network's management team maps out plausible regulatory changes, the pace of sensor innovation, and shifting reimbursement models over the next decade. They run structured scenarios, assign probabilities, and then craft a strategy that locks in supplier flexibility, cultivates workforce skills, and budgets for cybersecurity defenses. The result is not clairvoyance, but resilience, a plan robust enough to succeed whether change accelerates or stalls. Embracing futurology positions healthcare leaders to build systems that thrive in uncertainty while remaining firmly anchored to patient well-being. Building on our discussion of futurology, where we learn to think systematically about tomorrow, let us now explore future directions in health information technology. This phrase may sound lofty, yet its implications are intensely practical for anyone guiding a healthcare organization. First, the rise of person-centered health means information systems must follow the patient, not the other way around. Data collected at the bedside, at home, and even during a morning jog will need to flow seamlessly into clinical decision-making. As managers, you will be tasked with orchestrating infrastructure that respects privacy while allowing clinicians to view a complete, real-time portrait of each individual. Second, technical currents are accelerating. The network of everyday objects embedded with sensors, the Internet of Things, will exponentially expand data volume and vulnerability. Cybersecurity, therefore, shifts from an afterthought to a core competency. A breach is no longer merely an information setback. It can halt operations, erode trust, and trigger regulatory penalties. Forward-looking leaders allocate resources for continuous threat monitoring and cultivate a culture of security mindfulness among staff. Third, clinical informatics is maturing. Sophisticated analytics turn raw numbers into predictive insights, while intuitive data visualizations help teams grasp patterns instantly. Enhancing the overall user experience is vital. A beautifully crafted dashboard that reduces screen time by even 2 minutes per patient encounter can translate into thousands of reclaimed clinical hours over a year. Picture a community hospital executive who pilots wearable cardiac monitors for heart failure patients. Successful deployment demands vendor selection, robust wireless coverage, integration with the electronic record, staff training, and a clear cybersecurity protocol. By managing these elements cohesively, the executive not only improves patient outcomes, but also positions the organization as an innovation leader. That is the promise and the responsibility embedded in the future of health information technology. This slide bears the heading, Person-Centered Health, a phrase that signals a shift from treating conditions to serving whole human beings. In our last session, we traced the broad currents shaping tomorrow's information systems. Now, we focus on the most powerful current of all, the movement that places the individual at the center of every technological choice. Person-centered health draws together ideas from patient-centered care, precision medicine, and consumer-focused design. For managers, its importance is hard to overstate. When services are organized around individuals, satisfaction rises, clinical outcomes improve, and payment models increasingly reward those gains. 3 trends demand your close attention. First, access to care is expanding. Telehealth platforms and mobile clinics erase geographic barriers, but only if leaders create reimbursement pathways and training programs that make virtual encounters feel as trustworthy as office visits. Second, new care models highlight social determinants of health, factors such as housing, food security, and transportation. Integrating this data with clinical records allows organizations to direct resources where they matter most. Third, personal data are multiplying. Fitness trackers, home sensors, and even grocery loyalty cards generate information that, when respectfully managed, can guide tailored interventions. Imagine a health system operations chief who notices high remission rates for heart failure patients in rural counties. By layering telehealth follow-ups with neighborhood data on pharmacy deserts, the chief arranges doorstep delivery of medications and remote coaching sessions. 30-day readmissions fall, payer bonuses rise, and the community perceives the hospital as a partner rather than a distant institution. This is person-centered health in action, and it will become the standard by which leadership is measured. Let us now explore the topic of promising trends, a phrase that signals opportunity as well as responsibility. In our previous discussion on person-centered health, we saw how care is shifting toward the individual. Today, we widen the lens to the forces that will accelerate that shift and redefine leadership in the coming decade. First, consider the unprecedented flood of personal health information. Wearable sensors, genetic panels, and home monitoring devices generate streams of data that can illuminate risks long before symptoms appear. For a manager, the task is to build governance and analytics pipelines that transform these raw bytes into insights without overwhelming clinicians or violating trust. Second, emerging technologies demand a different leadership repertoire. Future executives must blend clinical insight with data literacy, cybersecurity fluency, and design thinking. Hiring profiles, training budgets, and mentorship programs need to evolve accordingly. Third, nanotechnology is no longer the stuff of science fiction. Products at the scale of 1/1000th of a meter can deliver chemotherapy directly to tumor cells while sparing healthy tissue. Within a generation, nanorobots may circulate through the bloodstream, diagnosing infection or clearing arterial plaque in real time. Managers who plan infrastructure to capture and interpret the data from these microscopic agents will give their institutions a decisive edge. Meanwhile, models of care keep evolving. Virtual wards, hospital-at-home services, and community hubs all hinge on a seamless digital backbone and an inviting user experience. Imagine a pediatric hospital that deploys swallowable nanosensors to detect gastrointestinal bleeding. The Chief Operations Officer must coordinate procurement, regulatory approvals, data integration, and caregiver education. Successful orchestration not only saves young lives, but positions the hospital as a beacon of innovation. These promising trends invite bold yet careful stewardship, and they place you, as future healthcare leaders, at the helm of transformative change. Our topic now shifts to evolving models of care, a banner that captures the ways service delivery is evolving beneath our feet. In the last slide, we explored promising trends such as the expansion of personal data and nanotechnology. Those trends gain real power only when they transform the care model itself, which is our focus today. 3 forces stand out: First, telemedicine has matured from a convenience into a strategic pillar. Video visits, remote monitoring, and electronic consultation widen access, shorten wait times, and reduce overhead. Second, the federal initiative called Emergency Triage, Treat, and Transport authorizes paramedics to manage many urgent problems at the point of need. By treating a diabetic crisis in the living room rather than the emergency department, it removes costly and stressful transfers and preserves precious hospital capacity. Third, value-based care pushes organizations to align payment with outcomes, rewarding teams that keep populations healthy rather than those that simply deliver more procedures. Why does this matter to you as future managers? Because each model requires new workflows, budgets, and partnerships. Imagine a regional chief operating officer who launches a home-based stroke recovery program. Telemedicine therapists guide exercises, community paramedics handle blood pressure checks, and the finance team tracks performance against value-based incentives. Readmissions fall, insurer bonuses climb, and patients gain confidence by recovering where they are most comfortable. Your role is to weave these elements into a coherent strategy that elevates quality while containing costs. Master that skill, and you will lead organizations that thrive in the next generation of healthcare. Our next topic carries the heading Patient-Centric Data, and it flows naturally from our discussion of evolving models of care. We saw how services are moving beyond hospital walls. Now, we investigate the information that accompanies each person on that journey. Today, mobile health applications and online portals pour out torrents of readings, yet most of these numbers remain isolated on a patient's phone or family computer. That separation is a missed opportunity. When such data are securely woven into the electronic health record, clinicians can spot deteriorating trends days before a crisis. Your charge as future managers is to sponsor platforms that gather, filter, and translate these streams into timely interventions while upholding every safeguard for privacy. Patient-centric data also reshapes professional roles. Clinicians who once controlled the record must now share that space with individuals who arrive carrying detailed graphs of nightly heart rhythms. Forward-looking leaders craft governance rules and training that respect this new partnership, turning patients into fully empowered collaborators rather than passive recipients. We must confront the digital divide as well. Some citizens lack reliable internet access or choose not to quantify their lives. Equity requires alternative pathways, such as community kiosks or nurse-led home visits, so that insight does not become another privilege. Picture a community health center manager who distributes connected blood pressure cuffs across a rural county. A spike triggers an instant alert, prompting a same-day video consultation and preventing a hospital admission. This example shows that curating patient-centric data is not a technical luxury. It is an essential leadership duty that advances quality, safety, and financial sustainability. Let us shift our focus to technical trends, the engine room that powers every innovation we have discussed. Building on our exploration of patient-centric data, we must understand the infrastructure that turns ideas into dependable practice. At the heart of these trends is the expanding network of connected devices, often called the Internet of Things. Picture blood pressure cuffs, infusion pumps, and even wheelchairs transmitting location and status across a secure wireless grid. In many hospitals today, remote monitors already track patients for 2 days after discharge, sending alerts that let clinicians intervene before a setback leads to readmission. Tomorrow, that same fabric could guide autonomous supply carts or smart shelves that reorder materials automatically. For healthcare managers, each sensor is both an opportunity and a responsibility. Seamless connectivity can sharpen oversight of patients and assets, yet every new endpoint widens the attack surface for cyber intruders. Leaders must shape procurement standards, segment networks, and provide continuous security training so that convenience never outruns safety. Consider a surgical center that tags every instrument tray with wireless beacons. Turnaround time between cases drops by 10 minutes, making room for an additional procedure each day. Revenue climbs, waiting lists shrink, and staff morale improves because frantic searches for missing sets disappear. These technical trends are not isolated gadgets. They are strategic levers. Master them, and you will elevate efficiency, safety, and patient satisfaction all at once. Cybersecurity threats and mitigation. Building on our discussion of emerging technical trends, we turn from opportunity to risk as more beds, pumps, and personal trackers connect through the Internet of Things, and as mobile health applications spread across every phone. The number of digital doors into a hospital multiplies. Each door invites innovation, but it also invites intrusion. For healthcare managers, safeguarding these pathways is not a technical option. It is an executive obligation. A single ransomware strike can freeze imaging suites, divert ambulances, and drain budgets in a single afternoon. Forward-thinking leaders therefore commission regular risk assessments, fund security updates with the same urgency as new magnetic resonance scanners, and embed cyber drills into disaster plans. Consider a children's hospital that discovered attackers probing a connected infusion pump network. The chief information officer responded by segmenting clinical devices on a protected channel, enforcing multi-factor logins, and contracting a 24-hour threat hunting service. Service disruptions fell to zero. Insurers rewarded the proactive stance, and parents regained confidence that their children's data and safety were defended. Cybersecurity is now patient safety, financial stewardship, and brand reputation rolled into one. Treat it with that gravity, and you protect both lives and balance sheets. Our next focus, beyond EHR 2.0, extends the conversation that just underscored the urgency of cyber protection. Once systems are secure, the challenge becomes making electronic health record environments smarter, leaner, and more humane. First, optimization. Current record platforms often slow clinicians with redundant clicks and scattered windows. Research that fine-tunes workflow, speed, or reduces alert fatigue directly converts to saved labor hours and fewer errors. Second, imagine a single, integrative view that unites laboratory results, social determinants, and home device readings on one dashboard. Such a view turns data into context, empowering teams to act rather than search. Cost-effectiveness and comparative studies also matter. As vendors promote cutting-edge interfaces, managers must ask whether a sleeker layout actually lowers readmissions, improves documentation accuracy, or merely looks modern. Usability testing, therefore, moves from optional to mandatory. Interoperability work will continue, anchored by choices about clinical vocabularies and ontologies. Selecting a consistent framework today prevents tomorrow's translation headaches when merging with regional partners or public health exchanges. Picture a multi-specialty clinic director who pilots a redesigned record module that surfaces wound photos and progress notes side by side. Documentation time drops by 2 minutes per visit, translating into 1 extra appointment per clinician each day. Revenue rises, staff frustration fades, and patient follow-up improves. For healthcare managers, pushing beyond version 2.0 is not about chasing novelty. It is about engineering efficiency, clarity, and ultimately better outcomes for every person who touches the health record ecosystem. Now, let's focus on analytics and data visualization, a natural progression from the discussion of an optimized electronic health record environment. Once information flows efficiently, the real power emerges when we can interpret that information quickly and clearly. Data analytics serves as the compass that reveals hidden patterns inside vast clinical datasets. By highlighting trends in readmissions, medication errors, or social factors, analytics transforms raw numbers into knowledge teams can act on. Effective visualization, clear dashboards, intuitive heat maps, interactive timelines lets professionals grasp complex insights at a glance, reducing decision time and sharpening accuracy. The future will demand rapid normalization and mobilization of healthcare data so that every note, image, and signal becomes clinically actionable almost instantly. Machine learning algorithms will shoulder the heavy lifting, scanning millions of records to flag emerging outbreaks or suggest personalized treatment paths. Leaders who champion skilled data teams and invest in visualization tools will position their organizations at the forefront of patient safety and financial performance. Picture a medical center operations chief who deploys a real-time sepsis dashboard fed by bedside monitors and laboratory systems. When the algorithm detects an early warning pattern, the intensive care team receives an immediate alert, cutting mortality rates and avoiding costly overtime staffing. By mastering analytics and visualization, managers turn information into life-saving, cost-saving action. We now move from analytics and visualization to machine learning and artificial intelligence, a frontier where algorithms not only describe what is happening, but anticipate what will happen next. 5 key trends deserve your attention. First, predictive analytics leverages historical data to forecast events such as readmissions or medication errors. Managers who embed these tools into daily operations can redeploy staff before a crisis escalates. Second, machine learning powers the learning healthcare system, one in which every patient interaction feeds an ever-improving feedback loop of evidence and practice. Third, intelligent models increasingly supplement clinical care. Triage chatbots sift non-urgent messages, and imaging algorithms flag subtle tumors that might elude the human eye. Fourth, we must confront risk. When social determinants of health, income, housing, language enter the model, hidden biases can amplify disparities. Responsible leaders demand diverse training data sets and continuous equity audits to ensure decisions benefit every community served. Fifth, interpretability matters. Clinicians rarely accept a black box verdict. They want to know why the system recommends a treatment. Transparent model design not only builds trust, but also satisfies regulators. Picture a metropolitan hospital that deploys an interpretable sepsis prediction model integrated with neighborhood deprivation indices. The system issues early warnings, yet also explains that housing insecurity raises risk. Case managers can then arrange home nursing visits, cutting mortality and aligning with value-based incentives. By mastering these 5 trends, healthcare managers transform machine learning from a buzzword into a practical engine for safer, fairer, and more efficient care. Moving forward from our discussion of machine intelligence, we now turn to human factors engineering, the discipline that studies how people interact with every component of a system so that both safety and performance reach their fullest potential. While algorithms promise rapid insight, it is the human-machine partnership that ultimately delivers care, and misalignment here can erase even the most advanced technical gains. 5 themes guide contemporary war. First, ergonomic interface design reduces cognitive overload, ensuring clinicians see the right data at the right moment. Second, alarm management focuses on filtering signals so meaningful alerts stand out, protecting teams from fatigue. Third, workflow integration tailors digital tools to real clinical rhythms, rather than forcing staff to adapt to software. Fourth, environmental design considers lighting, sound, and equipment placement to minimize errors and support patient comfort. Fifth, resilience engineering prepares systems to absorb surprises, whether a sudden surge in admissions or a technology outage. For healthcare managers, attending to these factors is a strategic imperative. Consider a rehabilitation center that rolled out motion capture sensors for stroke therapy. Initial adoption lagged because therapists found the on-screen controls cluttered. By applying human factors principles, simplifying navigation, enlarging critical buttons, and repositioning feedback displays, the center cut session, setup time by 40%, and boosted patient engagement scores. The investment paid for itself within 6 months through higher throughput and reduced staff frustration. When healthcare managers champion human-centered design, they translate sophisticated technology into tangible value, pairing staff well-being with operational excellence and, ultimately, superior patient outcomes. In this summary of the module, we gathered the threads woven throughout our exploration of information, science, and healthcare leadership. Powered by electronic records that share a common language, network devices that feed real-time insight, and analytics that transform numbers into foresight, modern care is no longer confined by walls. Managers now face the dual task of investing in advanced tools while protecting privacy, equity, and workforce well-being. The agenda demands foresight methods, rigorous usability studies, and relentless attention to cyber safety. Consider a rural integrated delivery system that launches a digital command center. By merging streaming sensor data, machine learning predictions, and human-centered dashboards, leaders direct resources toward the sickest patients, reroute staff around bottlenecks, and trigger mobile rehabilitation teams for those at risk of decline at home. Within 12 months, readmissions fall, supply waste drops, and patient satisfaction soars. This narrative illustrates how every concept in this module, from person-centered data to learning algorithms, converges into measurable value when guided by thoughtful governance. As future healthcare executives, you must cultivate interdisciplinary fluency, balancing innovation with ethics, cost, and cultural readiness. The roadmap we have traced equips you to ask sharper questions, test assumptions with evidence, translate discovery into dependable practice, and ensure these tools truly elevate community health. Over this module, we map 9 themes. We began with objectives that frame trends in electronic records and personal informatics. We explored futurology as a disciplined way to anticipate change and then examine future directions in health technology, person-centered health, technical advances, and clinical data science. We looked closely at evolving models of care, such as telemedicine and community-based triage. Patient-centric data highlighted integration challenges and equity. Technical trends cover networks of connected devices and their promise for efficiency. Cybersecurity underscored that digital safety equals patient safety. We moved beyond electronic record version 2 to design for interoperability and usability, then investigated analytics, machine learning, and finally human factors engineering, reinforcing that technology succeeds only when aligned with people. These insights now equip you to steward innovation with confidence responsibly. This concludes the module. Be sure to deepen your understanding by reading the excellent textbook.